Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
To begin the dissection work on the anatomy of the head, especially in the facial and the deep facial region, the first thing that must be done is for the facial area to be skinned. The dissection procedure should start at the base of the jawline and pass upward, reflecting the entire facial skin mass. In order to do this, you must very carefully reflect the skin from the underlying tissue, because the skin of the face, and especially that around the mouth and the eyelids, is extremely thin. Stay in the proper plane as we have done before when the integument has been reflected in other parts of the body. I'd like to demonstrate to you here in the eyelid area the extreme thinness of the skin. In fact, the subcutaneous connective tissue in the eyelid region is almost non-existent. In fact, I have reflected the skin partially in this area, and already we can begin to see some facial muscle fibers lying directly underneath the skin area, a very, very thin layering of subcutaneous connective tissue found in this region. This is not only true in the area of the lower eyelid, but of the upper eyelid as well, and the adjacent forehead. And there's a very prominent muscle in this area, the Orbicularis oculi, which if you don't dissect carefully, you'll be through that muscle and directly down on bone. Continue then the skinning of the entire facial area so that we can start the study of the facial muscles. In order to begin the dissection of the facial muscles, what you are expected to do after the skin is reflected is to use a sharp blade and to approach the facial muscles more or less in a shaving manner rather than a true dissection like we've been doing previously on the other muscles of the body. These muscles are very, very thin. They are subcutaneous muscles. That is, they are found in the subcutaneous tissue. They only have one bony attachment, that is to the skull, and they attach to the orifices around the facial area, the eye, the ear, and the mouth. We will not discuss those attaching to the ear because they are small, rudimentary muscles, but rather concentrate on those in the eye, nose, and mouth area. In order to proceed, we have to remember, first of all, that the muscles of facial expression in general are named by their action. For example, in the lower chin area, platysma muscle has already been removed, and that is one of the first facial muscles that we have seen previously. Here is a muscle that attaches to the lower margin of the mandible and passes up to the corner of the mouth. This is the depressor of the angle of the mouth. It will pull the corner of the mouth downward. Depressor anguli oris is its name. And closer to the midline, through this region, are fibers again that arise from mandible and pass upward to insert into the lower lip. This again is a muscle that will pull the lip down. It is the depressor labii inferioris, the depressor of the inferior lip. There is another muscle of the lower lip complex that is located directly on the midline, and it comes directly out from bone into the skin. In order to see that one, we have to turn the head sideways and look at the midline area. And the depressor of the lower lip is found between the area of the basal bone of the mandible and the alveolar bone that supports the teeth. And this muscle is very thin, and its fibers run directly from bone to skin in this area. This is mentalis muscle, and it's a dentally a very important muscle to talk about and to know its position. Just off the midline and coming from bone, going directly out into the skin of the lower lip. Let's then look at some of the muscles of the upper lip. Coming down from the cheekbone area, we have two muscles, one large and one small. Zygomaticus major here, with a split in it, which is abnormal. We usually do not find this kind of a variation of the zygomaticus major muscle. It arises far off to the side of the cheekbone prominence, and it passes down and attaches into the area of the corner of the mouth. In addition to that, sometimes almost as big as the zygomaticus major is the zygomaticus minor. And on this specimen, we have a very, very small zygomaticus minor that is going more into the upper lip than into the corner of the mouth. Zygomaticus major and zygomaticus minor. In addition to that, arising from beneath the anterior portion of the orbit, the bony orbit, are these muscle fibers that are passing directly down to insert into the upper lip. These are the fibers of the levator labii superioris, the lifter of the upper lip, levator labii superioris. And adjacent to it, and running along the side of the nose, is one of the longest named muscles in the body. It's the levator labii superioris, just as this one was, but it has a continuation of its name. The levator labii superioris dilator aliquinese. It's the dilator of the ala, which is the side of the nose. Again, levator labii superioris dilator aliquinese. These then take care of most of the upper lip muscles. There is another one that we will see deeper within. Now, in order to demonstrate all of these structures on one specimen is fairly impossible. And so for the remainder of our head and neck dissection work, we will be showing you 3, 4, maybe even a half dozen different specimens that have already been dissected. Around the mouth, not well shown in this specimen, where all of these muscles come together, is a circular muscle that goes completely around the oral opening, and it is called the Orbicularis oris. It is a composite muscle of all of these fibers that are feeding into this area. Now, before I stated that many of these muscles are attaching into the corner of the mouth, and that's why they get their name depressor or levator anguli oris. In truth, however, they are not coming directly into the corner of the mouth, but are attaching about 1 centimeter behind the corner of the mouth area, and this is called the modiolus. This area of attachment of these muscles is the modiolus. Now let's take a look at another specimen and see the anatomy on it. Again, starting down below, we have the muscle passing up towards the angle of the mouth, the depressor anguli oris. And as you dissect these muscles and clean them up, get the probe underneath the edges of these muscles so that they can be freed up and they will stand out much more clearly when you study them. Adjacent to this, again, depressor labii inferioris. From above in the cheek area, we have the zygomaticus major muscle passing down towards the corner of the mouth, and adjacent to it, the zygomaticus minor. Moving further to the side, adjacent to the nose and beneath the eye area, is the levator of the upper lip, levator labii superioris, and along its side, the levator labii superioris dilator aliquinese, some very small fibers that swing into the side of the nose. In addition to this, above around the eye opening, we can easily see here the circumferential fibers that enclose the eye area. These fibers are the orbicularis oculi. Remember, the other muscle around the mouth is the orbicularis oris. And then when we look at another specimen, we can see here on this specimen the nasal opening again is over towards your left. The chin is below. And here is a perfect example of two muscles I'd like to demonstrate once again. The zygomaticus major going towards the corner of the mouth, and next to it a very substantial zygomaticus minor muscle. Again, on this specimen, the depressor anguli oris shows up quite well. And around the eye opening, the fibers of the orbicularis oculi are clearly demonstrated along this lateral margin. Again, now on another specimen, we can see additional anatomy. We are now looking at this with the mouth pointed over towards the right. The eye is above the nasal aperture in the middle. Again, zygomaticus major stands out well, as does the circumferential fibers of orbicularis oculi. Very thin. Notice orbicularis oculi is not a heavy, thick, dense muscle. It's as thin as a piece of paper. I want to demonstrate something further to you, and that is in the lower lip area. Here again is the fiber direction of the depressor anguli oris. However, the depressor labii inferioris has not been adequately cleaned up on this specimen, and therefore you just cannot see any of the muscle fiber direction. As we turn this specimen over to look at the midline again, we can see but a few fibers coming off in this direction and passing upward to go into the skin of the lower lip. These fibers would be that of the mentalis muscle. The mentalis muscle, as I indicated, is very prominent. And now, switching specimens yet again, we can look down on the mandibular area. And this is an edentulous jaw. There's only basal bone. There are no teeth. The alveolar bone is almost completely resorbed. And so here, remember I said that the mentalis muscle abuts between the basal bone and alveolar bone. And when we look at this region then and pull it loose, you see the fibers coming directly out of the top front portion of this mandible going into bone. These fibers in through here then are mentalis fibers. If we would have had alveolar bone up in this area, of course, it would be at the junction point. But now, because of the bone resorption, we have mentalis arising from just off the midline and adjacent to the junction of basal bone and what was alveolar bone. On some of these specimens, then, you should continue your dissection work and follow out these various muscles. Here, for example, is a muscle we haven't seen yet. Again, the nose is lateral and to the right the mouth is below. And you would almost say, well, this is the levator labii superioris. It's been pointed out already. It's adjacent to the zygomaticus muscle and to the levator labii superioris dilator aliquinese. But this is not. The levator labii superioris has been removed, and directly deep to it, you will find this muscle going to the angle of the mouth, joining in with the zygomaticus major. This is the levator of the angle of the mouth, the levator anguli oris, where applied on top of it and having been cut off was the levator labii superioris. So in order to see this other facial muscle, the levator anguli oris, one must get underneath the levator labii superioris. This then is an overview like our other dissections have been. In no way is this meant to be a complete, definitive expose on all of the facial muscles, though this should, however, give you a background to find those few others that we have not discussed.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.